Hey everyone, and welcome to This Explainer. Today, we're diving headfirst into a massive, yet completely hidden global crisis. It's one of the most devastating public health emergencies of our time. But the incredible thing is, it's also entirely solvable. This is a tragedy that unfolds quietly in rural homes all around the world. But as we're about to see, rigorous data and structured research are finally lighting the way toward a real, permanent solution. Okay, to really wrap our heads around the scale of this issue, we've got to start with a truly staggering number: 700,000. That is how many lives are lost to suicide worldwide every single year. It's a massive global burden, and it's actually a recognized target under the Sustainable Development Goals. But hidden right inside this massive figure is a specific mechanism of tragedy that almost completely flies under the radar. Over 250,000 of those deaths, that's right, 14 to 20% of all global suicides are specifically caused by pesticide self-poisoning. Just think about that for a second. We're talking about highly toxic, cheap chemicals that are kept right inside the house or sitting within easy reach out in the yard. In moments of acute, overwhelming distress, having that lethal access right at your fingertips leads to hundreds of thousands of completely preventable deaths every single year.
Okay, let's dive into this. Here is our roadmap for today. First, a hidden global crisis. Second, Ethiopia's deadly data gap. Third, investigating the epidemic. Fourth, the math behind the truth. And finally, the path to prevention. All right, part one, a hidden global crisis, a preventable tragedy.
So, the terrible reality of pesticide self-poisoning is that this burden falls disproportionately on agrarian, low and middle income countries. Now, you might think the obvious answer here is just better hospitals or faster emergency response, right? What we'd call downstream clinical care. But because these incredibly hazardous chemicals are kept right in the home, the poisoning acts are highly impulsive and acute lethal. It turns out, restricting access to the most dangerous products, population-level prevention, is vastly more effective. Basically, if the fatal means aren't immediately available, that impulsive moment often passes and lives are saved.
Moving on to part two, Ethiopia's deadly data gap, a 2,400-ton blind spot. Let's look at how this plays out in the real world, specifically in Ethiopia. Get this, the country imports an estimated 2,400 metric tons of pesticides every single year. Agriculture is the absolute backbone of the Ethiopian economy, with 84.4% of affected households relying on it as their main livelihood. That means exposure to agricultural chemicals is exceptionally high across the entire population. But at the same time, regulatory enforcement is weak, and farmer training on safe handling is tragically limited.
Because of this, highly hazardous pesticides are just sitting there, cheap and widely accessible at the local community level. And here is the absolute core of the crisis. An estimated 24% of suicides in Ethiopia involve pesticides. But prior to this study, there was zero national evidence base. Literally nobody knew exactly which poorly controlled products were driving this death toll. And let's face it, you simply cannot regulate a killer if you don't even know its name.
Which brings us to part three, investigating the epidemic, a blueprint for truth.
To finally bridge this deadly data gap, an extraordinary effort was launched by Addis Ababa University, the Ethiopian Public Health Institute, and the Center for Pesticide Suicide Prevention at the University of Edinburgh. And this brilliantly illustrates their conceptual framework. They didn't just go out and count bodies. They meticulously mapped the exact pathway of the tragedy. They looked at the macro context of poverty and agriculture, mapped how that leads to cheap pesticide availability in local shops, tracked how those chemicals enter the household to create immediate risk, and finally, how that proximity results in the catastrophic event of self-poisoning. To guarantee their findings were rock solid, they deployed a massive triangulated mixed methods approach. We are talking about surveying 761 affected households across 6 different regions. They extracted 623 poisoning cases from 11 referral hospitals, combed through pesticide registry records from 2018 all the way to 2025, and conducted multi-agency stakeholder interviews. By cross-validating everything across hospitals, households, and government registries, they made absolutely sure that any chemical they flagged as high priority was backed up by undeniable consistent evidence.
All right, part four, the math behind the truth, finding the hotspots.
So now they've got mountains of data, but researchers faced a new hurdle. To measure true prevalence and find the actual killers, they needed advanced statistics to separate genuine hotspots from random small sample noise. First up, they deployed exact percent confidence intervals. I know it sounds super technical, but in plain English, It's just a mathematical way to prove that a sudden spike in poisoning cases in a specific region isn't a random fluke or bad luck, but a statistically defensible deviation from the national average that demands immediate intervention. Next, they brought in funnel plots with super strict 95% and 99.8% control limits. This visual model is vital because it stops areas with very small populations from artificially inflating the data. If a tiny village has just one incident, it might look like a 100% spike, right? But this plot filters out all that noise to identify community zones that actually have a genuine systemic excess of poisonings. Finally, they applied empirical Bayes shrinkage. So the crucial point is that this brilliant bit of math adjusts regional rates toward the national mean based on how precise the data actually is. Ultimately, all this number crunching produced a highly robust ranking of the most burdened cabellas, or neighborhoods, meaning the government now knows exactly where to target their life-saving interventions first. And that leads us to our final section, Part 5, the path to prevention, translating data to action. All of this exhaustive data and complex math, it really only serves one ultimate purpose: translating evidence into actionable, life-saving policy. As the researchers noted, policy, research, and community engagement activities were conducted alongside quantitative data collection to document perceived barriers to banning or phasing out highly hazardous pesticides. They weren't just crunching numbers in a vacuum, They were out there actively building relationships, engaging policymakers from agriculture, health, and customs. They were making sure that once the data was clear, the political will to break the cycle would actually be there too. By matching up their meticulously triangulated data with international FAO and WHO criteria, these researchers have handed the Ethiopian government an incredibly powerful tool. They have successfully pinpointed the specific, highly hazardous pesticides causing these deaths. For the very first time, regulators have the defensible evidence base they need to restrict, replace, or outright ban these fatal products from community shops. The blueprint has been drawn. The hotspots are identified, and the specific lethal chemicals have been named. The authorities have signaled their intent, and the data is crystal clear. The only question left is this: now that the evidence is completely undeniable, will regulators take the final step to ban these fatal products and save thousands of lives? Thank you so much for joining me for this explainer, and as always, keep questioning the world around you.